Hi, this is Dr. Ayda Başgül-Martin, and in this video I will talk about the hypersensitivity reactions. If you would like to see more videos, please click the subscribe button below to follow me. Thank you for your time. A hypersensitivity reaction is an exaggerated immune response to a non-harmful antigen. In all hypersensitivities, the individual is presensitized to a particular antigen. Some hypersensitivities, however, can affect almost anyone, but others happen only to people with an inherited tendency toward an exaggerated immune response. We have 4 types of hypersensitivity reactions. I put here mnemonics to easy remembering the types that we will talk in detail. Type 1, it's generally characterized by allergy and anaphylaxis. Type 2 is a cytotoxic. Type 3 has the immune complex development, and type 4 is a delayed type. And when I look to the first letter of all those descriptions, and if you remember acid, so you know that A for type 1, C for type 2, and I for type 3, and D for type 4, to easy remembrance. Let's go now and see in detail. Type 1 immediate reaction hypersensitivity is commonly called an allergy, and the antigens that trigger allergic responses are called allergens. In a type 1 hypersensitivity, a person becomes sensitized by producing immunoglobulin E antibodies in response to a certain allergen. In the initial exposure to the allergen, for example, peanuts, penicillins, pollens, bee venom, sensitized the B cells. The B cells started producing antibody production. The specific antibody related with the type 1 immediate reactions are the immunoglobulin E type. They afterwards attach to mast cells or basophils, plasma membrane, and activate them, stimulate them to produce some cytokines and histamine production. The cytokines can be prostaglandin D2 or leukotrienes. They are the good example. What they do, they cause the allergic reactions and anaphylaxis. The effect of an allergy depends on how widespread the response is. Allergy mediators dilate the arterioles and increase the vascular permeability, causing edema. They also cause contraction of the airway and intestinal smooth muscles and increased mucus production. The overall result is an inflammatory reaction responsible for the symptoms of the allergy, such as hives, difficulty breathing, or gastric disturbances. Anaphylaxis is a severe form of immediate reaction hypersensitivity and may be life-threatening. It's called immediate reaction hypersensitivity because it starts in the second exposure. It starts in seconds. Therefore, the term immediate reactions comes. Type 2 hypersensitivity is called antibody-dependent cytotoxic reaction because there is destruction. It's a toxic. Destruction of the cell is the common culprit. Hypersensitivities that involve immunoglobulin G and sometimes immunoglobulin M antibodies and take 1 to 3 hours or more to develop include the type 2 antibody-dependent cytotoxic reactions. In a type 2 hypersensitivity reaction, an antigen binds to a specific cell, stimulating the phagocytosis and complement-mediated lysis of the antigen. A transfusion reaction to mismatched blood is a type 2 hypersensitivity reaction. Let's go to the third one. Type 3 hypersensitivity reaction, when we talk about the type 3 hypersensitivity reaction, please follow me on this picture so you can see what is happening. In a type 3, there is soluble antibody and antigen complexes formed. As you see, antigen antibody complexes formed, and they deposit in certain tissues. For example, for systemic lupus erythematosus, antibodies are made that bind to certain nuclear antigens which deposit mainly in the kidneys, skin, and joints. For rheumatoid arthritis, that is for the joints. So first we said the antigen antibody complexes form and they deposit in the certain tissues. There they can trigger the tissue damage through the phagocytosis or complement binding. Rheumatoid arthritis is another good example for type 3 hypersensitivity reaction, and because the antigen antibody complexes that deposited in the joints that trigger the immune response and cause the joint destruction and tissue damage. Type 4 delayed reaction hypersensitivity may affect anyone. It results from repeated exposure of skin to allergen. Allergen activates the T cells in the skin, which they release the chemicals that cause the eruption and inflammation. It takes about 48 hours to occur. How it happens? Let's see the picture. And when you touch the poison ivy the first time, and that dendritic cells in your skin and synthesize the T cells, the T cells create the memory helper T cells. You have no obvious reaction that you can see on your skin. But when you touch the poison ivy the second time, in second exposure, memory T cells goes and activates the macrophages and cytotoxic T cells, and they cause the inflammation, lesions on the exposed site. This lesion, which will persist until the allergen is removed, can inflict significant tissue damage if it continues long enough. That's why if you touch the poison ivy, you need to make sure you clean out and properly and take the allergen away from your skin for healing. In this PowerPoint slide that you can see that type of the hypersensitivity reactions are summarized from type 1 to type 4. Type 1 immune reactant is immunoglobulin E, type 2 is immunoglobulin G or immunoglobulin M, type 3 immunoglobulin G and immunoglobulin M. For type 4, the immune reactant is the T cells. Good example for type 1 is the local or systemic anaphylaxis, seasonal hay fever, food allergies, and drug allergies. Type 2, mismatched blood transfusion or the hemolytic disease of newborn. Type 3 is the autoimmune diseases, example, post-streptococcal glomerulonephritis, rheumatoid arthritis, and systemic lupus erythematosus. For type 4, good examples are the contact dermatitis, type 1 diabetes mellitus, and the multiple sclerosis. I hope you enjoy it and you learn something. Thank you for watching.